I'd like to introduce Kurt. Kurt is 42 years old. He's been a patient of mine for a year and a half, and has a very interesting and complicated story about his testosterone deficiency disease. Let's just talk about what it was that was bothering you that the diagnosis was made. What were you like before you had effective testosterone replacement?
I really didn't have any desire in sex. I wasn't the most assertive person in the world. I found myself not interested in doing anything, not willing to do anything, confused. I was referred to some people as being shy. I would disappear in social situations, withdraw, both I guess physically as well as verbally.
What about the physical aspects of the deficiency? Your strength, your energy?
I didn't feel as if I was as muscular as I should have been. I have a younger brother who's more or less the same build as I am. He's much more muscular than I am. And despite me working out at the gym and trying to lift weights, I didn't notice that I was able to lift any significant amount of weight.
And your energy levels?
I was always very low energy, dozing off. Wherever I could sit down long enough, I would doze off. Even at traffic lights sometimes, I would doze off.
Even at traffic lights?
Yeah.
Would you say that you were depressed at all during those years?
Yes, I was. I always had this sadness that was like a sadness within me. It was almost like a weight on my shoulders, something always keeping me down. Not quite sure what it was or what caused it, but I was always had this sadness.
And you also mentioned you didn't have much in the way of self-confidence or self-esteem.
Not really, no. No, not at all.
And you tended to be confused and forgetful?
Very. I could have a conversation, and within 5 seconds of ending the conversation, I'd forget what transpired. I would notice that forgetfulness was so bad that I could be in my car, driving somewhere, forget where I'm going. Completely forget, just drive in circles.
You mentioned about being tense and having a short fuse?
Yes, I would fly off the handle easily. I wasn't sure if it was, I really wasn't sure what it was, but you could say something to me, I'd just fly off the handle. Just fly into these fits of rage.
And as you said before, you tended to be a little bit reclusive. You didn't socialize much.
Yeah, I decided that I wasn't sure what was going on, and rather than, I guess, alienate people, I just decided to just keep to myself.
And your lack of interest in sex was having an effect on your marriage?
Yes, it was. It was, and my wife would taunt me, and I would have to do things, I guess, to mask the problem, my lack of interest, my interest in sex.
And all of this started at what age, would you say?
I would say my mid to late 20s.
Mid to late 20s.
Yeah.
And would you say that over the decade plus it was been progressive?
It got progressively worse.
Okay, so now let's go, and we go back to when you were 29 or 30. So you had this for a few years.
Yes.
And you went to a physician who made the diagnosis of testosterone deficiency.
Yes.
And you were given the oral form, the methyl testosterone.
Yes.
What did that do for you?
At that time, I didn't really notice anything. That was prescribed to me by a urologist, and he had remarked that I would probably develop or increase my testosterone level naturally by exercising more. So
did you try that?
I didn't. I said, well, I've been exercising all along and didn't really see any benefit.
I think when it comes to testosterone and exercise, most doctors have the the cart and the horse confused. You know, you don't exercise and then get more testosterone. When you have more testosterone, you want to exercise. That's the relationship. How long did you take those tablets?
I was given basically a 90-day prescription, and after it was exhausted, I didn't bother to have it refilled.
Because it hadn't done anything or hadn't done much?
It hadn't done much. I really didn't see any significant benefit.
Okay. And so that was about 12 years ago.
Yes.
And then you didn't do anything about it for quite a while.
No, I didn't.
You were diagnosed with having type 2 diabetes in 2000.
Yes.
And put on medication for that.
Yes.
And then you were re-diagnosed as having testosterone deficiency in 2004.
Yes.
About 4.5 years ago.
Yes.
How did that come about? You had mentioned it to a physician?
I had asked a physician. He tested me, and the results confirmed that my testosterone was, I had low testosterone.
And what did he do?
He gave me a prescription of methyl testosterone.
Same thing.
Same.
And
I noticed a slight benefit. However, around the same time, or maybe a year after seeing the doctor gave me the prescriptions for methyl testosterone, I overheard an interview of Dr. Gordon on the radio where he mentioned testosterone, and I purchased his book. I read in his book that...
You mean my book? Me?
Dr. Gordon's book.
Okay.
And I read that taking oral or testosterone tablets could be harmful to your liver. And that's when I stopped and I found Dr. Gordon, or made an appointment to see Dr. Gordon.
Okay, so that brings us up to, those pills had done a little bit, but not much?
Not much.
Not much. Okay, so then we started you on the injectable testosterone in August of 2007?
Yes.
Okay. And what happened?
I would say, okay, within 2 days of my first injection, the first thing I noticed immediately was my vision improved. I've never worn glasses. I've always tested with having 20/20 vision. But I happened to walk out my porch, or was on my porch one day, and I looked up the street from my home, and I was able to see clearly a church steeple and the trees and the leaves on the tree. And this particular church would probably be about maybe half mile, maybe 3/4 mile away, and it was clear. That was the first thing I noticed.
And it hadn't been clear before the testosterone?
No, I just assumed that the church was so far away, that's why I couldn't see it clearly.
Okay.
Then I also noticed that the fog that I would try to think through, it was clearing up. The forgetfulness that I always had, I was able to remember things, both short-term and long-term. I didn't get, I stopped getting angry as easily. My self-confidence returned. I noticed that, especially during interviews, I was no longer trembling and sweating during interviews, second-guessing myself. I was confident in what I said and what I thought. I noticed when I exercised, I had endurance. I was able to lift heavier weights. Sexually, I became, in my relationship, I became the aggressor in my relationship with my wife. There was no longer any need for me to mask that problem with the ED drugs like Cialis and Viagra.
And you've mentioned a lot of things, and you also had mentioned before that you became a more social individual.
Oh yes, yes. I was no longer in my workplace. I work with my coworkers are much, maybe 10, 15 years younger than me, and I was no longer I no longer use the excuse of having to run home to do something for my wife or help my daughter. I was sociable. I would go out with them for drinks after work or dinner after work.
So it really changed your personality.
Yes.
But that only, you only continued on the injections for 6 months, until February of 2008, a year ago.
Yes.
And then you stopped.
Yes.
And the reason you stopped?
I couldn't afford the medication out of pocket.
You had lost your job?
Yes.
Okay. So you stopped it in February of 2008, and what happened then?
The fog returned, the absent-mindedness returned, the lack in sex, or me being a sexual aggressor, that kind of went to the wayside. I just felt a reversal of everything.
Everything?
Everything. A gradual reversal, including my clarity, my vision, my visual clarity.
Even that?
Yes.
So you went all the way back to where you had been?
Yes. Especially the simmering, or I guess the depression. That's what I also noticed.
Do you think it was worse because you knew how it could be?
Yes, I knew the before and after, and I didn't like the situation I was in. I didn't like my former self, or my pre-testosterone. So I didn't like it.
But then you got another job and you started it again 3 months ago.
Yes.
And
I would say
bring us up to date.
Total reversal. I know that, I definitely know for sure that that's, my pre-testosterone self is not where I want to be again. It's not where I want to be. And actually, I feel that my energy is, I feel the way I felt when I was probably 18, 19 years old. I am the outgoing person. I'm the initiator. I'm the outspoken person.
You're even smiling.
I remember things. I know from my facial hair, like my hair's growing the way it grew in high school. I have to get my hair cut every week now. It's ridiculous, but I like the way I feel, and I want to remain this way.
And there's no reason you can't.
Yes.
With all of this, anything negative to say about testosterone replacement? Any adverse side effects?
For me, no.
No.
No, I mean, not at all.
No. There's no bad side effect to being healthy.
No, not at all.
Not at all.
No.
Okay. Is there anything else you would like to say? How would you advise other people to look into this?
I would definitely advise anyone, I would say anyone who tries it will definitely benefit from it.
Okay, very good. We're back again with Kurt because we continued to discuss things after we finished the video, and he actually realizes that his symptoms of testosterone deficiency go back actually into his teens.
Yes.
You want to describe how you were as a teenager?
Yes, as a teenager, I don't recall myself being a typical teenage boy. I wasn't the most aggressive boy. I guess I kind of hid behind the label of being a mama's boy, being a nice boy.
And you're certainly not a small guy.
No, no. As far as like pursuing girlfriends and relationships, you know, it wasn't really something that was like high on my list of priorities. I always use the excuse, I got to study. I got to get myself into a good school. You know, the girls would come later, when in fact it was just, I just didn't feel, I didn't have that internal, or that push to pursue girls or pursue women.
And would you say that you were socially shy at that age?
Yes, I masked that by being a joker, a comedian.
But deep inside, there was a lack of self-confidence,
Yes.
a lack of self-esteem?
Yes, definitely.
What about strength and energy in those years?
Not really, no. I was more of a, again to mask it, I was more of a talker.
Not very athletic?
No.
Despite your size?
Yes. I was approached to play football. You know, my excuse was, I'm taking honors classes, I got to maintain my grade point average, just not interested.
So those are excuses?
Yes.
And you said you watched my video on video 11 on post-adolescent testosterone deficiency, and you identify with that description?
Yes. Yes, definitely.
Okay, so you have that condition, or had that condition too. Okay. Thanks for the follow-up.